Welcome back. Joining us now in the studio is Dr. Sudip Bose. On Wednesdays, we talk about medical health topics and we bring you the very latest information. Now, today we're talking about bike safety, which there's a lot of bikers, a lot of bicyclists on our roads out here. And of course, we know West Texas roads are very busy and can be very, very hazardous, very dangerous for these riders. How can we do this and go about it safely, Doctor?
Well, what's interesting here is we always think of sports-related head injuries as football injuries, especially here in West Texas. You know, football, we're thinking football for head injuries. Number one cause of sports-related head injury is bicycle accidents, including in West Texas. This is what I'm seeing, we're all seeing in the emergency room. And I don't think people realize that, so I'm glad we're covering this. And I'd like to give you a few more tips rather than just wear a helmet, which most of us know, and most of us are hopefully doing. But, you know, besides wearing the helmet, make sure the helmet fits. That's always a good tip. And as far as the bicycle safety tips, you can divide it into two things. You can divide it into like bicycle maintenance and then rider safety. So let's talk about what you can do with your bicycle. Number one, you know, let's make sure there are reflectors on it in case you don't want to wear this neon orange reflector vest when you're going out, although it's safe to do this.
It looks pretty cool.
This can be stylish.
Yeah, I think so.
If you're riding at night.
The matching hat. Yeah,
exactly. Get reflectors on your bike. Check the chain on your bike. Make sure the air is filled on the tires the proper amount. So keep the bike maintained. And then as far as rider safety, other than a helmet that fits, there are a few other things that we see in the emergency room. Long pant legs that can get caught up when you're pedaling. That can cause accidents and a fall. Backpack straps often get caught on things. I've seen tree branches, you know, hit the eyeballs. All sorts of different types of injuries. Statistically speaking, most patients, about a third of them are under age 20, so parents out there, that's an important message for you guys. And almost all of these, most of these happen at, or a large fraction of these happen at intersections, so be extra careful at intersections.
Those, absolutely. And as whatever you can do to eliminate these hazards, like you said, the long pants, anything really to help would be great, because there's so many other hazards once you get out into the elements that anything you can do at home before going out is critical. Right,
and you know what? We can control what we can control. We can't control the behavior of others. So just be defensive, you know, defensive riding in your bicycle, and then just common sense things. Don't wear headphones where you can't hear the traffic. You know, these are common things we see in the emergency room and very preventable accidents. And let's avoid the number one cause of head injuries in sports-related head injuries in the United States.
Absolutely, and also a quick note on the other side, we have the drivers out there on the roads. Make sure you share the road. That's really, I want to drive that home, because there's a lot of bicyclists, especially now. West Texas is getting more and more active. I feel like I'm seeing more people out being active, running and biking, which is great. But we all got to share the roads together, and we can all look out for each other.
We all want to look happy like this when we're biking, and unfortunately, the ones we see in the emergency room, the patients we see, are not this happy because they did not take these steps. So be careful.
Dr. Sudip Bose, thank you always for great advice, great tips for us. And if you have any medical health-related questions you want answered here on the front page, go ahead and submit them to the email on your screen or those Facebook pages you're seeing right now. We'll be right back. Stay with us.